We're just in Omarion Hampton's being placed on IR with that ankle injury. So that tells us a couple things. So it told us he was in a walking boot. It tells us that he's missing at least 4 weeks. That's pretty indicative of a high ankle sprain. We talked about before how the timeline for that is around 2 to 4 weeks. It can obviously be like a week longer than that as well. But usually that's the typical time frame for return. With them saying IR, though, that means that he's out for a minimum of 4 games. That also, they didn't really specify if it was a high ankle sprain. They just said out with an ankle injury. So there's a small possibility he could have like an avulsion fracture off that distal fibula, which connects the anterior talofibular ligament from that tibia bone to the top of that talar dome. I think more likely it's a high ankle sprain, but either way, that would still be around that 4 or 5 week minimum. Aside from that, who should you pick up? You should probably pick up Vidal, although Haskins is going to have a role as well. It's kind of unfortunate because their offensive line is pretty brutalized right now. So I'm not sure if either is going to be a very viable option, but you should at least stash one just in case for some reason they pop off. Just a bit of a teaching pearl here. This exam is called the Kleiger's test, and it's how you do a sideline diagnosis of a high ankle sprain. If on this motion the person is feeling pain in this high ankle region, then you can diagnose a high ankle sprain clinically and then get the MRI to see the grading of how severe it is.